Unfortunately, lung cancer is the #1 killer in the US and the entire world. It's the third most common cancer affecting both men and women. However, it's the #1 killer. We're talking about a cancer that is hard to detect. For the majority of early stage cancer, they're not going to have any symptom whatsoever. And that's why it's really difficult to detect it at an early stage unless you are looking for it. Whenever we detect cancer late, the chances of survival or cure get lower and lower and lower. It all starts with a small nodule, a tiny spot on the lung that is detected on a CAT scan. Lung nodule does not always mean cancer. There are 3 ways to biopsy these nodules. Number 1, you can have it cut out. Number 2, we can have it with a needle through the chest. Or number 3, it's my specialty, which is the ION, robotic assisted bronchoscopy. It's a robot that has a very thin channel that can navigate to the outer skirts of the lung, where 70% of nodules occur. Once I get there, I can take samples that can be studied under the microscope to tell us what type of lung cancer it is. Within one procedure, we get a diagnosis, we get a stage, we refer them to oncology or the cancer doctors or the thoracic surgeons and go on from there. For example, I had a lady who was seen in the oncology clinic on a Monday. I saw her on Tuesday. She had a procedure on Wednesday. We got an answer on Monday and she went back to the cancer doctors where she started treatment. The median time for getting an answer and getting started on treatment nationwide is 57 days. That's 2 months. In that particular case that I told you about, it's 2 weeks. 2 months versus 2 weeks. A lot could happen in 2 months. Because the earlier you detect it, the more options you have. Cancer, whatever type it is, it's not like a one man's job. It's like a team approach. And here in St. Francis, I have to say that we have a pretty amazing group of people that we're working with. The level of care that is offered by St. Francis Medical Center rivals that of the biggest centers that I have personally worked at. Lung cancer is a very difficult disease to cope with, but it does not mean it's a death sentence. It's no longer a death sentence. Lung cancer has many options for treatment regardless of the stage. St. Francis Healthcare System provides one of the best shots at curing or treating lung cancer.